Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning, Anita.
Did you see the sunrise this morning?
Yes, of course, driving here. Oh, beautiful. I enjoyed that.
It really makes you know that life is worth living, even with all the travails and
I miss my
sad
friend
parts.
Wendy. She lives right by the water, and I used to live by the water. It's beautiful to watch the sunrise, take a picture, and share with friends and loved ones. So Wendy is away out of town, so I have not obtained the picture that she would send me. Her and her mother, they are faithful listeners, so I know they are listeners. So good morning to them and everybody else that had been with us for so many years.
There's
now.
another person. Her name's Jolynn. I think you saw Jolynn when Jolynn was having some problems with depression, and you had some good advice, and she is not depressed any longer. But
Beautiful.
Some of her depression really came from loss. A lot of losses. Is that what you see in your practice?
Yeah, that's one of the topics that should be coming soon in our Boomer Time magazine. Is end of life and the life after. End of life and the life after. Because first of all, we get those loss that come to us that are sudden. We are with a loved one, or we care for a loved one. And we are not expecting that person to leave us. And very suddenly they will go away. And that's very painful, extremely painful to those who remain behind. And including us, the caregiver, the physician, the nurses. And I tell you, sometimes they call me and they say, Dr. Mencia, so-and-so died. I say, what? Like, I wasn't expecting that. She was doing so good. Blood pressure is great. And you wonder, oh, my God, what happened? So some of them have a massive heart attack in their sleep, and they die. And then sometimes we get those patients that, or those loved ones that we know they are sick. You just went through a loss of Snowy, who used to come here with us, and when you sent me that email, a tear came to my eye because I used to see Snowy just sit here with us, and he's so loving. You will go and caress him, and he will love it. And if you leave him alone, he will love it too.
Followed me if I walked out of the room. He
He
followed
will
me to
follow
make sure
you
I was
everywhere
okay.
you go. And we lost Snowy, and I know that it was cancer, metastatic cancer that he had. But still, even though you find out and there's nothing else we can do, it's still painful, even though we know it's coming. And
as a physician, I've often wondered how it is for you, because you understand all this, but you still are very sensitive to this.
Of course. When one of the things, I got training in hospice because I became a geriatrician. So to me, that was a privilege to be training hospice, to know how to handle, how to deal with comfort care and end-of-life care. But there are many physicians that don't have that training. So if we look at the way people are normally trained, we are trained to save life, not to end life. All our training goes into a person has a symptom, and we're going to be the hero that's going to come up with the diagnosis, and then we're going to be the hero that's going to come with the right treatment. And the hope is that we continue to be the hero and save a life. But sometimes, we lose the battle, and it hurt us. I mean, it hurt me when I lose a patient, and I always ask myself, what else could I have done better? What else I need to do better for the next patient that comes, so that won't happen to me again. But it's a fact of life that no matter what we do, there are patients because of their age, their gene. They just gonna die at one point. We all gonna die.
I read something that a doctor, an elder doctor once said, "When the day we're born, we're dying."
And that is true. Yeah, we are, because you start developing, you look at your ovary in a woman. There are so many eggs that you have. And as you start every menstruation that you go through, you get rid of eggs. You get to a point you have no more eggs left. They're gone. So the sperm in a man, as we age, we get less and less sperms. So hair and so on. I mean, the day we are born is a process. Life is a process, and dying is part of living. Just like birth is part of living. So it's a sad subject, but some people make it very happy. And
well, you know how I'm dealing with this, as you mentioned about Snowy. Snowy made us very happy, and we made Snowy very happy. And someone said, "Do you want to get another dog?" I said, "Well, if I can make another dog happy, I'm going to do it." It's
of course,
something
of course,
that you have
yeah.
to. It isn't always about you; it's about others.
Yes. Yesterday they had the competition in California of the ugliest dog in the world.
You're kidding.
Yes.
The ugliest dog in the world.
And a Chinese Chihuahua was the winner. But I get patients that come and they say, "Oh, I just adopted this dog, and has a leg that was broken by a car accident or something, and they adopt the dog." And those pets are happy. Snowy was so happy when he came into your life, and you could see it. He was so peaceful, so at home. So,
and he passed that on to us.
And he passed that on to you.
And he passed it on to you and a lot of other people who saw it, right?
I would come here just, making, oh my God, what's Snowy? And when he couldn't come anymore, you felt the emptiness, of not having Snowy here in the studio with us.
But let's talk about people who lose a loved one, a spouse, a child. The memories are very deep. And so do they get on medication? How do they, is it just time?
That's a great question. Usually it's time. Normally, you have to the grieving process. You have to go through that process, and you go through stages in the grieving process. You go through bargaining. Oh God, if you don't let him die now, I promise you I'm going to go to the synagogue and I'm going to do this. I'm going to go to church. I'm going to do that. Oh, God, you start bargaining. If you are religious, you bargain with God because God is almighty and powerful. So you bargain with God. Or you bargain with the loved one. Don't go now because I'm going to do this and this and this and you're going to love it. Please don't go. So you go through the bargaining process and you go through the denial. No, this is not going to happen to me. Until eventually you go to the acceptance and say, he or she is now in a better place. He or she is not suffering anymore. And you go into the acceptance that that person have died or you. And that's when the process is not sudden. The sudden one, like I said, is the worst one. And then we usually, when we are giving tests to future doctor, we ask them, if you lose a loved one, who do you think will produce the highest impact on the person that remain behind? If you lose your parents, if you lose your spouse, or if you lose your kids, or if you lose a friend. And then the student have to choose. And a lot of people, depending on their cultural background or what have you, they will say, oh, the parents or the kids. In reality, it's the spouse.
Really? I would have said kids.
Yeah, exactly. It's depending on your cultural and your attachment and your belief. In reality, the loss of the spouse is very impacting on the loved one. So then, then come the kids and then come the parents. And then also the people remain behind when it's the parents, depend on the age. If a teenager lose their parents or one of their parents being a teenager, it's very impacting. Same thing when teenagers see the parents go through divorce. It produces a high impact. That's a loss. A divorce is a loss. You lose in a house, you lose in the togetherness, you lose in the meaning of family. It's a huge loss, divorce. So when teenagers go through divorce, it can have a psychological impact for the rest of their life. So, as you know, I was a psychologist before I became an MD. So this is where psychology is gold. It's gold because if that kids go through psychological counseling, they don't have to be on medication for the rest of their life. But when we put our head in the sand and we go on the denial phase of what's going on, and we stay on that phase for too long, then those kids end up being affected for the rest of their life. When we are more adult and, the parents are getting divorced and what have you, and say, they're behaving like kids, and, adult kids, now they can handle things better. And then it becomes a vicious cycle. If my parent got divorced, then I would have a tendency of being divorced. Then my kids will have it because they lived through it. They say, I live with my parent being separated. So it's easier for the kids to, down the road when they are married, when they go through a difficult situation, to see divorce as a way out. Very easily become a way out. So there are many ways of losing loved one. It doesn't have to be dying. It could be divorce. It could be other things. You can lose part of your body, and it's a loss.
We had that last week when you were on with Stan, was it, or it was
Alan?
Alan. Sorry, it was Alan.
Alan
with his right,
and he lost his limb, and so he divorced his limb. It's a loss for him, but he managed. And how he managed, of course, he had a good support system around him.
And now he helps people.
And now he's helping other people go through the process. So, with every loss that we have, sometimes people, they tell me the loved one that remains, say, I don't know what to do. And say, go to a retirement community. Go and see people that don't have the privilege of... I just lost a patient of mine. She was in her 90s. She was a doctor, a lawyer, but she was a professor. She had her doctor's degree in law. And she will come, and everybody in my office will call her doctor. And sometimes the new assistant will say, what kind of doctor is she? She's a lawyer, doctor. Oh, she's a professor. Oh, so she will call her professor. No, you call her doctor. So, and her son got... bless him, was so supportive of her. He would, bring her to the office. And she was very stoic lady. She would come to the office and used to walk to the office. Then she eventually ended up in a wheelchair as she went over her 90s. And then it got difficult, and the son called me and said, it's really difficult to bring mom over, but she doesn't want to let go of you.
So that's when you went to home?
I said, well, something, we have the home visiting program. Can we set that up for her? He goes, okay, let's do that. And doing the home visit, because she was getting confused and she was having problems with incontinence, it was really difficult. It was getting hard. And we started going to the home, and when she started getting better, she told the son, do you mind taking me to Dr. Mencia? I want to see him.
That's right. That's interesting.
And he goes, oh my God, it's like she came back. So whatever you guys were doing at home, she came back and got strength to get on the wheelchair again and come back and see you. And she came a few times until she decided to go with God. And
so she passed away.
And she passed away peacefully, very peacefully. And that's another beauty, when we have people that they have wishes, and they will tell you, I want to die at home. Whatever you can do to make sure I die at home, do that for me.
And why do people want to die at home? I mean, it seems pretty obvious.
I would love to die at home because I guess, when you go to the hospital, it's a system that is not your house. It's a sterile, blah, blah, blah. Change your diaper at 6 a.m. You're going to eat breakfast at 7. Well, what about if I don't want to eat breakfast until 10 o'clock or 11? Why do I have to have breakfast at 7 o'clock?
But isn't that good? Why
what
hospice?
About if I want soup?
But you can have hospice at a hospital also. But it's still not the same.
Not
the same.
It's still not home.
So
it's your bed at home, what you have. It said,
Okay.
let me see my grandkid picture. You just go and reach over and grab it and pass it over. Home is home.
So you encourage your patients, if you know that they're in their last months, or to be at home.
To be at home or what they want. Some people, they love to be in a hospital. They want that catheter to be put in there. They want to be clean. They want to have a nurse. They want somebody to change the diaper and change the bedding and do this and do that. And they just ring the bell and somebody will come anytime. There are people that what is it that you want? What will make you happy? Some people, they want to be at home with their loved one. I remember with my father-in-law. He has colon cancer, and it was with metastasis and all of that. And we put the bag and so he could poop through the bag because he could no longer go to the bathroom normally in the toilet. So we went through all of this with him. And toward the end, he had multiple admissions. I was his doctor, my father-in-law. And he pulled me to the side. He said, Andy, if I'm going to die, if you see that I'm getting close to the end, I want to stay in your house.
Wow.
I want to die in your house. I want to die.
Oh, my heavens.
You next to me.
Oh, my goodness. That was beautiful. Wow, that was so beautiful.
So when I saw it was the end, I called the whole family together. I put the whole family together and said, I think Dad is coming to the end, so I'm going to take him home. Everybody was okay with that because that was his wishes. And he was able to express that to the family. And, I don't smoke cigarettes, right?
Oh, no.
Yeah, I said, Daddy, I'm going to bring you home, but in my home, you don't smoke inside the house. If, just get on the wheelchair and go outside in the patio and you can smoke and then come back inside. He said, okay, deal. The day before he died, he goes, Andy, I'm so weak. I cannot go outside, but I want a cigarette. You know what I did?
I know. What did you do?
I took a cigarette. I lit it up. I lit up the cigarette. I took a few puffs to make sure it was lit up. I put it in his mouth. He took a few puffs. He said, okay, that's enough. That's all I want.
Oh, my goodness. Oh, that's a very sweet story.
Yeah.
I want everyone to
and
know
then
that.
The next day, he died.
And he died. Well, that's only someone like you. I know you too well. Dr. Andy Mencia, this is who's been performing for us this morning. It's always a performance. It really isn't. We want really for you to see Dr. Mencia while he's doing his performance. So we're working on something. We hope we're going to get him on YouTube to have our own TV channel, our own YouTube channel, because Dr.
That would be
Mencia,
nice, because a lot of patients, they ask me, what does Anita look like? What do you guys sound like? How do you guys see it? What's the house they show?
Now, that's what we want to do. We're working on that. So hopefully that's going to happen. But Dr. Mencia is available for you to go to his Fort Lauderdale center. It's AGI Medical and Dental Centers. It's on East Commercial Boulevard. The phone number is 954-489-1345. And also they have another center in Boynton Beach now, and it's 561-270-6494. You heard about home visits for homebound patients. But the nice thing about their centers, and Dr. Mencia can talk about that in a minute, about that they have all the auxiliary professions there, and he watches over everything, and it's really special. They're open on Saturdays, extremely important. So, Dr. Mencia, I don't know if we are allowed even to say what the name of the show. We love this Dr. Dr. Well?
Not yet.
Not yet? Why not?
We're gonna let Richard and Nina. Richard and Nina is gonna come together and put something nice for us.
Yeah, we're gonna put this all together so you can see this.
Yeah.
But getting back to what you were just talking about with loss, it's there's no way, in a sense, that you can really prepare for loss, even when someone is very sick.
No matter how much you are expecting it to happen, it's gonna be painful. And you have to be prepared. You have to be brave. It's like if you're going to run 10 miles and you are not used to it, you know you're going to feel pain as you train for the 10-mile run. And when you do the 10-mile, when you go in your competition and you do those 10 miles you wanted to do, you accomplish that, you're going to feel pain. So you have to be prepared. You cannot do it you cannot just get up one day, get off the wheelchair and say, I'm going to run 10 miles. It's not going to happen. It doesn't work like that. So a lost one is going to be painful, and you have to prepare yourself. And you have to be brave. And like I said, sometimes the sudden, unexpected loss is the most painful one. I lost one of my younger brothers to an aneurysm of the brain. And it was unexpected. He never get headache, went to the emergency room twice. And he said, well, I'm expecting my wife to come back. She's on vacation out of the country, so I can wait for her to come back. And I said, well, then you are just probably depressed. Just go and see a psychologist. He's probably going to depression. They didn't even do a CAT scan on him. They sent him home, and his sister-in-law said, why don't you just take 2 Tylenol and go to sleep? As he was walking, took 2 Tylenol, was walking toward the bedroom. When she opened the door, he was laying down, face down, dead. That's sudden. That's unexpected. Your younger brother, it's like you expect them to live more than you. You expect them to take you, to bury you.
So as a physician, you have, I'm sure, a lot of patients that you deal with this. And when do you know to give them sedatives or something to help them through this?
Once we know that the death is imminent, then with our job is comfort, a peaceful death. So once we know death is imminent, sometimes the lung produces a lot of secretion. So there's medication like atropine that we give for that will dry the secretion so they don't drown in their secretion. If they are in pain, their medication we can give them for pain management. Some of them can go through the nose, under the tongue, intravenous, injectable, by pills, to be taken orally, per rectum. We can put in the rectum through the anus. We can put a suppository with pain medication. So there are many routes, many ways. Patches, we can use a patch and put it on the skin. So there's around the clock they are pain-free around the clock.
And what are you going to do for the caregivers who
and the caregiver,
right?
That's where hospice is so important. And a lot of time I tell my patients that hospice is not the death sentence. It's a path that we can get. You can get on 95 to go someplace, but you can get off 95 if the traffic is too bad and take a parallel route to where you want to go. So hospice is not a death sentence. It's just a path that we take. And when we take hospice and we are going on that path, a lot of time I tell my patient, listen, things are not looking the best, and I like hospice to come in. And they look at me like, you mean I'm dying soon? And I say, no, but I want them to meet you like you are now. I want hospice to see you the way you are now. I don't want them to come in when you have a week left. And there is nothing you can say because you are so sedated. You have no say. I want them to meet you now. And hospice will come in and they will come and do an assessment. They get to meet the patient, talk to the patient about the wishes. They know more than me. And hospice is not me. Hospice is a whole team. with the rabbi or the priest and the social worker and the nurses and the pain management. It's a team hospice. And when hospice come in, they take from that team, what is it that we need at this time in place? We might just need the nurse. We don't need the rabbi yet. We don't need the priest. We don't need the oncologist. We don't need pain management. You might not be in pain, but the team is there. They know you now, and that team, when they have meeting, I used to go to the hospice meeting, and we will discuss cases. And there are people that go into hospice, and they improve, they do better, and they come out of hospice.
That's a very good point that you just made. I actually had some of the people from hospice on my radio show quite a few times, and then they invited me to see the physicians and how they talk about everything. And you're right, but you know what happens when, and I don't know if this has happened to you, but when you're with the kids and you say you want them to go into hospice, no, let's not do that, because it is like a death knell. Mm-hmm. And so you were very good in explaining it. It just makes the path easier. One
of the things that I do, because I'm hospice trained, sometimes hospice is a consultation. I know time is over. Hospice is like consultation, like consulting another doctor. There are hospice out there that as soon as they come in, they want to bombard you with medication and take you off from all the medication. And that's why when my patient go into hospice, I don't sign off. A lot of doctors say, you're going to hospice now?
Because you don't get any more money.
I'm no longer your doctor.
That. You're wonderful. I know
stay
about
with my
you.
Patient.
I know about you. And we have to say goodbye because you've got patients waiting for you down there. But thank you very much.
And you have a wonderful guest coming in.
Yeah, we do, Dr. Feinerman, and we're going to try to make people better because of his ideas. Thank you, Dr. Mencia, always.
Thank you,
I loved your caring so much. Yeah, I know. You're wonderful. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.